Hello and welcome. Good morning, friends. This is Dr. Aishvarya Kaushik. Welcome to the question of the day. Today, we will be discussing a very important MCQ pertaining to the diagnosis and the pain pathway and the innervation of the dental pulp. Right? So, let us just look at the MCQ. I'll share the screen. All right. Fine. Now, the question is that pain from a tooth is characterized by. Now, as I said in my previous videos also, the first thing is just have a glance on the options, right? What the examiner is trying to, from where the examiner has taken the topic, but don't look at the options, very keenly and on the first glance, right? So if you just see he's dealing with A delta fibers, A delta, A delta. So basically, what the examiner is trying to ask us is about the information, whether we know anatomically which kind of nerves are the terminal nerve endings to the tooth of the dental pulp and the dentine pulp complex. So we all know from our knowledge that A delta and C fibers are the terminal nerve endings which take the sensory information to the central nervous system, where at the level of the cerebral cortex, the any sensation is finally perceived as pain. Now, if we just go according to the Erlanger and Grasser classification, A delta fibers are myelinated, albeit lightly. They're very thinly myelinated, but they are myelinated, and C fibers are unmyelinated. So they're myelinated and C fibers are unmyelinated. Now, the nerve impulse conduction consequently will be faster for A delta fibers versus the C fibers. Consequent to that, or as a result of that, we realize that the kind of pain sensation that is elicited when we stimulate the A delta fibers is faster, right? Is sharp pain versus a dull ache, continuous, deep, boring, dull ache of the C fibers, right? That is the main inferences that we take from our Erlanger and Gasser classification. So let us see the options. Now, first of all, no option pertains to C fibers, so that is excluded. Now, A delta fibers, let us look at what explanation or how the examiner is trying to confuse us. Myelinated or unmyelinated? They are myelinated. We all know that. So C option gets cancelled. D option gets cancelled. So we are dealing with myelinated A delta fibers, myelinated A delta fibers. Now let us look at the other details. Sharp pain versus dull pain. Now dull pain is not carried by A delta fibers. It is carried by C fibers. So B option gets cancelled. We reach the correct answer. That is option A. Right, friends? So that is the approach with which we solve our MCQs. We don't let our examiner confuse us, right? So friends, keep working hard. That was the question of the day. Thank you for watching this video. Best wishes.